Good evening again. My name is Shunil Shalri, the founder and president of Supporting Girls in Sports. I will also serve as your moderator for this session. This session is titled Recovering from Injury, and this is our 6th athlete development workshop. I will let you know a little about our facilitator, but first, please ensure that you mute your mic when you are not speaking, and you can turn them on when you're ready to speak. Also change your name to your real name so you can be easily identified. So about our facilitator, Miss Marita Marshall is a qualified sports physiotherapist with over 7 years experience in the physiotherapy field. She holds a BSc in physical therapy from UWI Mona and a master's in sports and biomechanical medicine from Dundee, UK. Not only does she operate her own private practice, POPs, but is also the co-founder of the wellness company, the Health and Wellness Physios Incorporated. Her specialty is sports rehabilitation, and she has a keen interest in public health as well as women's sports. Marita has traveled and worked with a number of local and international sporting teams, including the West Indies women's cricket team. So this is just a little about our facilitator. She will let you know more. Over to you, Marita.
Good evening, everyone. Thank you for joining. And today I'll be talking about recovery from injury, and I'm going to get right to it. So here is just a brief outline of what we will be talking about today. Basically, what happens after an injury occurs, the general sequence of injury rehab, as well as some other factors to consider throughout the injury process, rehab process, sorry. Okay, so an athlete gets injured or a person gets injured, and then it's like, what's next? Whether it's a simple ankle sprain or something more traumatic like spinal trauma, injuries can change an athlete's or individual's life drastically. It changes their routine and everything. And it's very important that whatever injury it is, that an athlete is able to seek professional help very early, making sure they focus on the present moment, which can be hard at times, but with the right support, they can get through it. And then begin the rehab journey with the guidance of a physiotherapist. And being patient and trusting the process is also very important before returning to sport and functional activities. Okay, so looking a bit at the injury response now, how an athlete will respond to an injury is dependent on their personality as well as psychological factors. So some of the things that an athlete will think about or consider when an injury occurs is the severity of that injury. If they're on a team, perhaps the security of their position, maybe even their ranking, if they're in a sport where their ranking will change if they're not participating. So these are a number of factors that will be on an athlete's mind when an injury occurs. They also will experience feelings of fear, isolation, as well as loss of identity, because most athletes, and especially professional athletes, their sport is what they do for a living. So when they get injured, they are unable to earn, they're unable to play their particular sport and do what they love. So they will have that feeling of loss of identity. And basically all physical injuries will elicit a psychological response, and that's something that we have to be mindful of, because persons often just focus on the physical side of things. And it's important to recognize that along with that, there's also going to be a psychological response, which is very important in the process of injury and rehab. And with that being said, the rehab process has to keep that in mind, and the treatment of any injury or an athlete has to consider both physical and psychological needs. So looking now just at some of these stages that occur or phases in injury, of an injury occurring. So you have that immediate period right after that injury occurs, which is within 0 to 20 minutes. And in that period, what you're really trying to do is to make sure that the athlete is safe, they are stabilized, whatever injury it is stabilized, they get the necessary medical attention that's required, whether it be calling an ambulance, getting a physio, getting a doctor. So within those first few minutes, it's really about keeping the athlete calm, getting them safe, and making sure you stabilize whatever is happening and getting the necessary help that's needed. No, the acute phase is within the first 0 to 72 hours. So within the first 3 days, first day to 3 days. And that's when we really want to work on managing any swelling that's in the area, any pain management at that time is going to be very important as well. And then we move into the subacute phase, which is between 3 to 10 days. And in this phase, you're becoming, there should be less pain, starting to maybe start doing some exercises, some strengthening, depending on how the athlete is doing. And then moving into the active rehab phase. Now I have varies here because the subacute phase can sometimes maybe take longer than 10 days. And then there's certain markers that have to be met in order to progress to the active rehab phase. So their pain level has to be at a certain stage. There has to be a reduction of swelling. They have to be able to regain range of motion in whatever area it is before we can move into the active rehab phase. And then that active rehab phase also varies because starting strengthening program, they have to pass certain tests in order to get into the functional rehab phase, which is the final stage. Functional rehab phase is final stage of rehab, and that's where they would begin to participate in activities and skills related to their particular sport. So in order for them to do that, they have to, would have regained full range of motion. All the swelling, all the pain should be gone by that phase in order to move into that functional rehab. Okay, so looking now at some of these psychological phases that also go along with when an injury occurs. So most times you'll have a bit of denial. The athlete sometimes may, in less severe cases, try to minimize their pain. So they'll maybe say, well, it just feels tight or stiff. And they might not want to say that it's painful or that they're experiencing pain in the area. Sometimes there's a bit of anger and blame. They will blame perhaps the coach, the weather, the equipment, maybe their shoes, socks, something. And they're a bit angry because of whatever happened or whatever led to their injury. And then in the bargaining phase of things, they kind of acknowledge that they're injured, but they still want to play. They still want to participate in their sport. So they will tend to maybe either try to train when they shouldn't be or ask their physio to return to training before time. They also will experience a little bit of depression because they're away from their sport or aren't able to train and participate as they would like. And then there's acceptance, where they accept that they're injured, they accept that they have to participate in rehab, they accept that, they aren't able to earn for this period of time, or they just come to a level where they accept everything that's happened to them and they're willing to work through it. Now, each of these phases, some athletes or persons might skip through different phases or spend different lengths of time in each phase. So there's no set time to say, okay, well, the denial phase is going to last a day or the anger phase is going to last a week. So different persons will spend different time in each of these phases. or might even skip from one to another. But it's important to recognize that these are some of the psychological phases that an athlete will experience and go through when an injury occurs. Okay, so looking at some other key components in recovering from an injury, apart from having the right personnel, doctors, physios, sports psychologists, it's important that there's good communication, not only amongst the team that's managing the athlete, but also with that athlete directly. So there needs to be very honest and frank communication about the needs of the athlete. There needs to be honest communication about the expectations of the injury, return to sport. There needs to be thorough goal setting and realistic goal setting. These goals should be time specific as well as realistic. Like I said, you want to set both long-term goals and short-term goals. And yeah, there needs to be good communication also about progress through the rehab process. In addition to that, it's very important to build cooperation, patience, trust between the physiotherapist and the athlete. That is going to be very crucial in allowing the rehab process to be smooth, allowing the rehab process to be successful. And it's one of those things that you really have to spend some time getting to know the athlete, being patient, listening to them, and building trust, because they need to be able to feel confident in you leading their rehab process and in the team overall managing that athlete. So as I said before, in terms of goal setting, it needs to be specific and realistic. You don't want to set goals that will be difficult to meet and leave the athlete disappointed. It's also important to make sure to maintain team association and sport involvement of that athlete or individual. So that just means that they should still be involved in the sport in some way. Even if they're not playing, they can still attend practice sessions, attend training sessions, and help out other ways, maybe help out the manager of the team or help out the other players on the team in some other way so that they don't feel isolated. And let them become involved in their sport as much as they can until they are able to play again. It's also very important to evaluate and re-evaluate very often throughout the rehab process. Things will change from day to day, week to week. So it's important to make sure you continue to assess and reassess and share that feedback with the athlete so that they know where they are at in their rehab journey. And it's also important to celebrate those achievements and celebrate reaching those short-term goals and those long-term goals along the way. So it keeps the athlete encouraged, it builds motivation, and they can sense that things are moving on and they're getting somewhere. Okay, so looking at the sequence now of the injury rehab process. So you have, like I said earlier, the initial injury occurring, and then there's a number of personnel providers who will assist in the entire rehab journey. So initially you're going to have your physicians and doctors involved, and they're going to be important in examining, evaluating, diagnosing, advising on any surgical requirements or any imaging diagnostics that need to be done in order to make that diagnosis. And then you also have physical therapists, athletic trainers, and again, physicians all working together to come up with ways of how you're going to minimize the pain, minimize swelling, protect the injured area, and come up with a plan for the rehab process. And then rehab pretty much starts. Again, you have your physios, your athletic trainers beginning to work to restore motion, beginning to work on strengthening. And as the rehab process continues, then you get strength and conditioning coaches involved or trainers involved, and they will begin to work on strength and endurance. And then in the final stage of rehab, you have, again, strength and conditioning coaches as well as physios working together for that athlete to begin to readjust to getting back into their sport. So integrating more skills, more drills, and so forth into their rehab. Okay, so I spoke really briefly about this just now, but it's really important to make sure that as soon as that injury occurs, the person, like I said before, is able to see a qualified professional and able to make the right diagnosis. Now, accurately diagnosing the injury is important because that's going to guide the entire rehab process and what you do and how you manage that injury. So it's important to make sure you have a sports physician, if possible, or physiotherapist assess and do a thorough examination to see exactly what's wrong. In some cases, imaging may or may not be required, for instance, x-rays, ultrasound scans, MRIs. So in that initial assessment phase, that's when we'll decide what is needed and then come up with a plan of management of that particular injury. Perhaps surgery might be indicated or it may not. And then just determining what is the best way to manage this particular injury. And then we move into the rehab phase. And like I said, again, you're going to have your physiotherapist working along with athletic therapists, athletic trainers, sports psychologists, and everyone needs to be on the same page, communicate well, set goals, work on pain management, strengthening, proprioceptive exercises, and so forth. And there needs to be, like I said before, frequent assessments to track that rehab process. And the strength and conditioning coach or trainer is that person who will come in and begin that process of return to sport and return to training and competition. It also, this period also provides the opportunity to identify and correct any risk factors that could lead to re-injury or further injury. And then, like I said before, again, you have that end stage rehab, which is very sport specific training. And it is what we call the functional training phase, where the athlete is now able to get back out onto the field and participate in drills or activities that are related to their sport. And during this time, actually throughout the entire rehab process, we need to make sure that you challenge the athlete sufficiently depending on what stage they're at. And especially in this stage, because we need to know that they are ready to return to sport or return to training. So this phase needs to be vigorous enough and test them enough so that we are confident in them returning to training and being able to handle demands of their sport or game. Okay, return to play is something that can be very tricky to navigate. Most athletes are always ready to return to their sport training way earlier than is often suggested. And that also could be because of a number of factors, whether it be pressure from sponsors, pressure from coaches, pressure from teammates, family. You know, every athlete or person who is into sport, or person who gets injured wants to be able to get back to doing what they were able to do before they were injured. But this needs to be managed. So first of all, they need to be cleared by their team, a team doctor, sports doctor, or physiotherapist. And we also, again, need to assess or do some assessment of their psychological readiness to return to sport or participation in whatever activity they need to get back to. In most cases, some level of fitness testing should be included. And it's important to recognize that all this is necessary because having an injury is a predisposer for further injury, whether it be re-injury or injury to somewhere else. So we really have to make sure that we check all our boxes, and when the athlete returns to training and competition, they do not come back out with another injury or with the same injury. And basically, it can be difficult because in some instances, pressure from coaches or a team and sponsors can weigh heavily in when they return to play. But at the end of the day, the athlete's health and safety must be at the forefront when making that decision of if the athlete is ready to return to their sport. And this is just a start framework that was developed to help guide professionals in making that return to play decision a little bit easier. So in the first section, you have an assessment of their health, where you look over their symptoms, other medical history, and then you look at their level of activity risk. So the type of sport that they're playing, if it's a contact sport or a non-contact, the position that they're playing, the competitive level, if it's amateur, professional, the ability to protect that area. In some instances, you might be able to protect and get them back to their sport a little bit quicker with taping or bracing. And then assessment of risk. So the time or the season, what stage are we at? How much are we willing to risk here in letting this athlete get back out there? And a number of other factors to consider there in terms of managing their risk. And then you make that final decision of return to play. So in cases of professional athletes, you'll see the sports medicine teams having to sit down and have these kind of discussions because these players are high profile. They will definitely need to get back out there as quickly as possible. At the end of the day, like I said, we have to make sure that the athlete's health and safety remains at the forefront and that we are not putting the athlete at further risk for repeat injury or injury otherwise. So that brings me to the end of my presentation, and I am now ready for any questions.
Hi, good afternoon.
Hello.
Hi, are you hearing me?
Yes, I'm hearing you.
Rorel Varanga, national swim coach here in Jamaica. For an injury like distal bicep tendonitis, the situation I had a swimmer with it. The situation during therapy required that the swimmer stay totally away because almost most of the actions aggravated it. How do you treat an athlete like that is unable to go in their field of play? You know, your recommendation for one like that, how long do you stay away? Because a sport like swimming, you need to remain with your feel for the water.
Okay, thank you for that question. That's a good question. First of all, it's a little bit difficult to say without having done an actual assessment on that athlete, but I would assume that they would have been seen by either a sports doctor or sports physiotherapist who would have assessed and given a grading for that injury, if it was a tear, how bad that tear was, and then based on that diagnosis, been able to say, well, they need to rest completely for perhaps maybe 2 weeks But during that time, it is not that the athlete is going to rest from all activity because it's only the bicep that's injured. So that doesn't prevent them from beginning rehab, from participating and doing cardiovascular strength work other ways. And once that period of acute, subacute phase has passed, perhaps even getting back into the pool and doing activities like just kick, that wouldn't aggravate the arm itself. So there are ways to keep an athlete active, and of late, recent, management of injuries has changed slightly from past days where most persons would advise complete rest, and we actually promote activity very early. But again, at what stage that activity begins will be determined on how bad that injury is or the level of the injury is. So I can't say exactly how long because I don't know. I wouldn't have assessed that person. But I would say that there's definitely ways to keep an athlete active from the beginning of an injury occurring right up to getting back into their sport.
Thanks. You pretty much assisted somewhat, because the recommendation was during the therapy to remain in the field of play. However, the session had to be weightless, and as I said, swimming is very unforgiving. You're away from the field of play. You lose your feel for the water, and the recommendation was to remain in the field of play with reduced activity. And it's almost over now where there's no pain, but principle of specificity would have taken the athletes away from sprinting routine and having to just resort to slow, work. But thanks very much.
Yes, you're welcome. And that's right. It's important to remember load management as well, coming back from an injury, managing how much and how you progress their load, whether it be swimming, basketball, tennis, any sport, management of their load is super important. So sounds like you're on the right track. Any other questions? This is your time to ask. I am willing to answer any question.
Good evening.
Hi.
Hi, I came a little late, so I'm not sure if you mentioned it. I know you're a physiotherapist, but I'm thinking, especially if you have an injury or whether it's a serious injury, that might take a huge mental toll on you, and you might even have a mental block for doing the proper exercises and physiotherapy to get better. So you as a physiotherapist, do you ever find yourself in a situation where you may recommend to the client that they get help, or maybe it's an injury that they may not be able to fully recover from?
I think I missed a little of your question, but yes, it's very important to make sure that that athlete or person is able to see a professional and gets professional help early, and not weeks after the injury occurred. So if possible, it's advised that the individual is assessed by either a sports doctor or a physiotherapist. And if it's a sports person, a sports doctor or a sports physiotherapist will be preferred. And I hope that answers your question. If it doesn't, tell me again.
Oh, well, it answered part of it. It was just in regards to, I'm thinking, when you have to heal, and depending on your sport, some injuries it might pretty much put you down, thinking you may never be able to get back up to your potential. So sometimes that could put a mental block for you to actually get better and do the proper exercises and activities to get better. So do you sometimes recommend to your clients, okay, you have this block, maybe you should see your sports doctor or whatever in regards to this.
Yes, so I think you would have missed the first part of the presentation where I would have spoke about not just focusing on the physical needs, but the psychological needs. And there are instances where persons may get injured and think that the injury is worse than it actually is, and that prevents them from seeking that initial assistance that they need, because they're thinking, oh, this is probably going to be really bad. I'm probably not going to be able to play, or they're going to tell me to rest and I don't want to rest. So then that sometimes can lead athletes or individuals to put off getting that initial assessment. But we're possibly do advise that you have that conversation as early as possible, so that you know exactly what's happening. And if you have the right team and the right set of persons around, however bad it is or small, they will help you make the best decisions to manage that injury.
Okay, thank you.
You're welcome. Any other questions?
I have a question. Are there, can you hear me?
Yes, I can hear you.
Okay, great. Are there any injuries you'd say persons can take care of at home as opposed to going to a physiotherapist? Or should you wait until it's very serious or minor and you run to a physiotherapist?
No, I do not think that you should try to manage things on your own or use Dr. Google, because in most cases, you might miss something. And I always advise it's best to at least have that initial consultation and this initial assessment. And that way you can be given an accurate diagnosis and not self-diagnosed. And you can be guided in how to manage that injury throughout the phases of the injury occurring. So you can have an assessment, and your physiotherapist or doctor would then give you advice on how to manage within the first 3 days, and then what needs to happen after those 3 days in the subacute phase, and then what needs to happen after 2 weeks, which you might be able to find online or otherwise, but sometimes it's always best to have an assessment, and that way you can be guided accordingly, and at least your physiotherapist will be able to maybe give you guidelines for how to manage things going forward. If it is that you can't afford it, at least they'll be able to give you a home exercise program and tell you how to manage the injury in each phase. So no, I don't advise persons to self-manage or self-diagnose. Yes.
Hello?
Yes, please.
It's not a question, but to the young lady earlier and even now, I recently learned, as you speak, everything you speak about a team around you. And I want to caution persons against Google, because I have a YouTube channel and I have a Google channel. I'm not a physical therapist. So a lot of time, some of the information that you might happen upon is not credible information. So having a team, yes, additional cost where an athlete is involved, regardless of sport, but it is the best way forward. I have had multiple athletes who have sought the intervention of the team, and they have returned to full participation, no complaint, no more injury. And as the case that was mentioned, yes, the psychology will get you beyond the injury, because if you're not able to, again, trust your body to push beyond the advice. But the key you had said earlier, Madam, was the gradual return and not wanting to pop back in because the coach, the mom, the dad, or whoever wants you back to up to speed. It's hard to miss a competition or two. Some people will seek a one race or one game glory versus long-term athletic development, which should be cautioned against.
Yes, and I agree with you completely. And especially in the case of younger athletes, most people tend to think, oh, young, it's going to heal on its own. But we also need to consider the fact that not managing this small injury now can lead to further injury down the line. And then it's just not the best thing to do. So I always advise to at least have the initial consultation. You get the diagnosis, get a set diagnosis, and get information on how to manage that injury throughout the phases. And that's really the best way to go about it. I think I see a question in the chat. Does the time frame vary not only on the severity of injury, but also the area of an injury, like in a case of knee injury in comparison to the ankle? That is a good question, but it will vary. It will vary based on what the injury is. So I wouldn't say the area will make that much of a difference. It depends on what it actually is. So it's not to say that a shoulder injury is gonna heal faster than a knee injury. It depends on what that shoulder injury is or what the knee injury is to determine how soon or how quickly that will heal. I hope that answers that question in the chat. If it doesn't, let me know. Any other questions? Feel free to unmute.
But while we wait for another question, I really like the point about visiting a physiotherapist instead of diagnosing yourself. I asked that question because I think it's important. Most of us try to resort to Google, and Google may give you some extreme diagnosis that has nothing to do with what you have. So it's very important that you visit a physiotherapist or a sports doctor when you're injured. I hope that everyone got that message loud and clear. We don't want anybody to stay away from their sport and go through any mental health problems as a result. So I just hope everyone paid attention to that portion.
Yes, I definitely agree with that. And in most cases, it saves you in the long run. So if you're looking to save money, then it's best to do the right thing from the start, because if you wait too late, then it's a bit of a mess to fix and unfix the mess that you made. And again, if that initial injury isn't managed properly, it predisposes you to either re-injury or further injury. And it just gets way more complicated. So yes, it's always best to make sure you get a consultation with a professional early. And thank you for everyone in the chat who is saying very informative. More questions. We have like 5 more minutes, I think.
I think I have I had asked my question initially, and I think I would like to add on to a lot of what was said by you, and bringing some. I'm bringing personal experiences, because, as I did mention, I'm one of the national coaches. Hi, Sharnil. Little did Sharnil know that the injury athlete I was talking about was Anita. Anita is a regional record holder, and we had to manage it properly. She's now injury-free. She's back to sprinting, preparing for the World Junior Championships. Thanks to the team, including the psychologist, we'd had to coach her through really challenging herself again after the injury, because there's always that fear of re-injury. You mentioned the team. The team is not the physical therapist alone. Yes, a little bit out of pocket than we are accustomed to going home and icing, but it's really worth it.
And I appreciate you reinforcing all of my points. And it's good to see that, that you and persons in general, I hope, are getting that message of an injury occurring is not just physical. There are both physical needs that need to be looked after, as well as psychological needs. And the cascade that occurs when an injury happens also includes has a psychological component and cascade. So we have to manage both of them effectively and efficiently. And like you said, it's a team of persons that need to work together. But at the very least, at least a physiotherapist.
Do we have any more questions or queries before we end? Also, please check the chat. Ms. Marshall has dropped her email address if you have any other questions. As you see on the screen, she has her social media information, so you can follow her there and ask questions there too.
Yes, I love questions and persons reaching out, so don't be afraid. If you have any questions, reach out at any time.
Well, if we have no further questions, I'd like to thank everyone for coming. Thank you everyone for coming and for paying attention. This was a very informative session. I think it's very important. As an athlete, injury plays a huge role in who you are and how you cope with your sport. So it's important you know how to recover from injury. So this session will be available on our YouTube channel, Saint Lucia Basketball Federation, for viewing, and if you would like to view it again.